Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are preparing for the GOLD Obstetrics Online Conference of 2020. And with me here today is one of our speakers, Dr. Fedro Peccatori. Welcome, Dr. Peccatori. Peccatori? I'm so sorry. Peccatori.
It's okay, you know, peccatori means sinners. And pescatori in Italian means fishermen. So I don't know if it is better to be a fisherman or a sinner, you know, but I'm a sinner, unfortunately, so you have to stick with peccatori, but that's fine. It's a
Well,
pleasure to be here with you and with all the, listeners of this fantastic conference.
Well, thank you to have a good sense of humor there about my little mistake there. Thank you so much. And it's wonderful to have you back here with us. Back by popular demand. You've been speaking with us in the past before, and so we're glad to have you back here. And the last time we spoke, you were in Milan, Italy, in that region. You were still in at the height of the COVID-19 epidemics. Give us a little overview over your work and how it is looking now for you in your area.
Well, I am a medical oncologist and a gynecology, and I work at the cancer center. So for us, during last spring, was really very difficult because the numbers were increasing very fast, and not only the numbers were increasing fast in terms of COVID infection, but also, the occupation of the intensive care and the hospitals was really difficult. Now the numbers are increasing, almost as fast as it happened during the spring. And in the last days, we have seen really a huge increase in numbers of infections. Fortunately, the quality of the infection is different, the epidemiology is different, there are more younger people, and so also the pressure on the health system is lower, but we have to be very cautious because we have seen also in other countries here in Europe how fast can it go and how bad can it be.
Are you, do you feel you and your hospital and your staff are well prepared for the kind of what they call the next wave?
Well, we are better prepared compared to the first wave for sure. We have more personal protection device and we have the mask, and we know better how to treat those patients, and there are more numbers in intensive care units. So this is fortunate. Of course, this is a different time of the year, so we will have also a number of different kind of infections, and it will be really challenging. But I'm optimistic. I really still think that we can, go forward and, get rid of it.
Yeah, absolutely. So your presentation here at GOLD is titled Management of Breast Cancer During Pregnancy. And I'm so glad you're presenting on that topic because it is such a difficult topic, right? We're talking about two lives here. We're talking about the mother and the baby, and it's also a very emotional time for a woman if she receives that diagnosis, right? And often, having to decide if to possibly end the pregnancy or not. So I know from your work that you're doing wonderful work out there in this field. So tell us a little bit about what we can be learning here.
Well, as you said, it's a very difficult situation. All diseases during pregnancy are difficult to manage, but cancer is particularly difficult to manage because it has, a bad reputation. So women who are diagnosed with breast cancer during pregnancy, also other type of cancers, are always very scared for themselves and for their babies because the issues there is, will I receive a treatment that can be harmful to my baby? And what if I don't receive the treatment? So if my prognosis is influenced by the fact that I cannot receive the proper treatment during pregnancy. Fortunately, I must say that nowadays, women who are diagnosed with breast cancer during pregnancy can receive the correct treatment without impairing the health of their babies or their fetuses. So it's a more, let's say, a reassuring message.
That's a very positive message, more reassuring, as you mentioned. Yes, because looking back, speaking also to other care providers, it was mainly, if you receive that diagnosis, often women were told you need to have, you need to look after yourself first, and terminate the pregnancy and get treatment right away. So you're telling us this is not necessarily the case. There is treatment available that is also, safe for the baby.
Yes, you're right. In many occasions, women are told just to interrupt the pregnancy to go
Hmm.
for abortion because sometimes that is easier for the
Hmm.
healthcare provider than easier for the healthcare provider, not for the woman. And so you should be very balanced in presenting the data, and the evidence is available. And one of the evidence available is that the pregnancy termination does not improve prognosis. And why so? Because you can treat effectively breast cancer during pregnancy, and so the idea of terminating the pregnancy just to improve prognosis is a wrong idea.
Mm.
So the take-home message of my presentation will be that there are a number of things that you can do during pregnancy, going from diagnosis to surgery to chemotherapy. And there are a number of things that you should not do during pregnancy, for example, radiation therapy or giving hormones, anti-hormonal treatment that is used outside pregnancy, or giving some monoclonal antibodies that can be useful and can be given, but after delivery.
Oh, I see. Well, that sounds wonderful. That is good news, really, that there is a treatment available. Now, there is this perception going around, and I might be totally wrong with this, that breast cancer in young women is, number one, more aggressive, and then during pregnancy even more aggressive because of the biology of pregnancy. What do you say to that?
Well, it is true that breast cancer in young women is usually more aggressive. I mean, the biology of breast cancer in young women is definitely different compared to the biology of breast cancer in older women. And it's a rare situation. So it's around 7%, 7 to 10% of women that are diagnosed before the age of 40. So, but is a misconception that the biology of breast cancer occurring during pregnancy is different, is more aggressive. Sometimes women tell you, well, I felt the tumor, and in 3 days it grew bigger and bigger. And that sometimes is true, but it's not due to the pregnancy, it's due to the biology of the tumor, which is exactly the same compared to the biology of tumors outside pregnancy in
Mhm.
young women, of course.
Interesting, interesting. Yeah, thank you for clarifying that. Also, young women, or younger women, especially, pregnant women, they often think this cannot happen to me. This is, breast cancer happened to older women. My mother's generation, not me. I'm pregnant. This is not. It can't happen. So what do you tell, our women out there, that we should always be diligent, and feel for any differences in the breast, even during pregnancy, right?
Yeah, absolutely. I mean, awareness of the possibility that breast cancer can occur also in young women is essential, because in younger women, you don't have really screening programs. So you
Hmm.
don't have programs for mammograms, for example, that
Right.
happens after 45. And it's true that this is the case for two reasons. The first reason is that less frequent, so you wouldn't, embark in a screening program. And the second, that the mammography is not as effective in younger women compared to older women. So it's a matter of just being aware of the fact that if you have a nodule in the breast, and this occurs in young women or in young women that are pregnant, and that nodules increase of size and does not regress spontaneously, that's a red flag. And so if
Hmm.
there is a red flag, you should go to your treating physician or midwife or obstetrician, and just tell her or him, well, I have this, and an ultrasound it's usually enough. So an ultrasound
Right.
also during pregnancy can be done, no problem, and you can identify, the different situations.
Yeah, which is a safe way of screening. And last question here for you. In your practice, have you seen an increase in breast cancers in younger women, pregnant women, or is that also a misconception?
Well, from my observatory, in my center, we see a lot of breast cancer in young women, and a reasonable number of breast cancer occurring during pregnancy. Of course, this is a bias of observation because we are referral centers, and so we have one patient per month approximately with this situation. Remains a rare situation. There are some data that the numbers are increasing, and this is possible due to the change in reproductive behaviors. Women tend to postpone their pregnancies, and so being older at the time of pregnancy, there is an increased risk of getting cancer just because of the age. And then there is also some data that also the percentage of breast cancer in young women is increasing. So it's these two data, call
Mhm.
for more awareness of breast cancer during pregnancy, the higher number possibly.
Mhm. Well, thank you so much, Dr. Peccatori, for sitting down here with me and talking about your work, your wonderful work that you're doing out there, and about the presentation here at Gold. It was a pleasure.
It's a pleasure also for me.
And to our listeners here, the presentation is part of the GOLD Online Obstetrics Conference of 2020. The conference will be started on November 9th of 2020. And if you're curious about this presentation and the other presentations in the conference, please visit goldobstetrics.com. Thank you, everyone. Bye-bye.
Thank you. Bye-bye.